Professor Prince has done a lot of work looking at prevalence of dementia in different parts of the world, and the current projections are today we have probably 47 million people with dementia, and by 2050 it will triple in the world. What is new is that there starts to be evidence, at least in some locations, in UK, in US, that maybe the incidence has declined a little bit. So maybe the projections might, in the future, it's possible that it will not be the sort of that high increase. There's going to be an increase because there are more and more older people, but perhaps it's not as dramatic, at least in certain regions. But that is a really, we have a few studies in few locations, so this needs to be really looked at in different populations and with very good methodologies, because that's of course always a challenge to how do you define your population, how do you define your dementia cases so that it will remain the same methods of the cases in prevalence studies. That's very, very important. The fact that there are more and more older people, and now the projections show that there will be so much more people with dementia, so I think that puts emphasis that we need to act on risk factors. So that's our chance to bring down the numbers. So if we manage to somehow reduce the incidence, then we will have fewer cases in the future. And that's really important, especially now that at the moment we do not have a cure. There's lots of drug trials as well going on, but I think prevention is something we can do already today.